Kenya's Ministry of Health says the East African nation is facing an acute shortage of oxygen in hospitals across the country. This is due to the rising number of COVID-19 cases as the country experiences a deadly third wave, with some Kenyans in private institutions stocking up on the commodity. Health Minister Musahi Kagwe says Kenyans are hoarding some 20,000 oxygen cylinders in private facilities, homes and institutions. Well, Dr. Moses Masika, a virologist from the University of Nairobi, joins us via Zoom. We'd like to thank you for joining us on the program.
Thank you, Millicent, for having me on Channel S TV.
All right, reports say Kenya's ICU beds are filling up, oxygens are scarce. Give us a picture of the situation there.
Well, before COVID-19 struck, we had a very few beds, ICU beds, and also very few infectious disease beds since the outbreak started in March.
And you were giving us the situation updates. Also, while you're trying to respond to that, tell us about some of the policy responses in this third wave that's affecting Kenya right now.
Yes, sorry for the audio hitch. We have expanded our bed capacity over the last 1 year due to COVID-19, but even that currently is strained by a third wave that is much bigger than the first and the second wave that we saw last year. And for that reason, we are having not necessarily full capacity ICUs, but the resources that are required to monitor these patients, and especially oxygen, which is needed by many of these severe COVID-19 patients, is not always enough. In fact, we have reports of people on oxygen and then all of a sudden it's over, and some of these patients do pass on because of lack of it. So our resources are currently strained because of a third wave that is much bigger than what we had in the first wave in last year, sometime in June, and also in March, and also in June, and also in November last year when we had the second wave. I think the last week or last Friday, we had our president give a new, or rather a revised version of the policies and guidelines to fight COVID-19. They struck a good balance between protecting lives and livelihoods, as has been the idea before. And this is because we locked down the Nairobi metropolitan area. These are several counties surrounding Nairobi where the infection is most severe, with over 70% of all new cases. And so this is the so-called disease infected zone that no one can move into or out of. And because of that, we are hoping that we'll be able to limit the number of people moving into the rest of the country, although we know COVID is already in those other parts of the country. So this will sort of limit, or is expected to limit, the number of new infections outside those areas, and also focus the resources to the counties that need it the most. We've had, of course, a lot of back push from business caucuses, from the transport sector, tourism sector, and what have you, and even the restaurants and bar owners that are trying to push the government to cut them some slack so that they can be able to trade. But we've not seen any changes in that front. Of course, there are a lot of people who are suffering because of loss of jobs and income. So the government is trying to balance this with, of course, protection of life. So in my view, I think the policy guidelines are well measured. Of course, a lockdown would have been the best, but that would not be practical, and it would probably pose more challenges. In the meantime, we're also giving the COVID-19 vaccine, not as fast as we should, and that is a common challenge across all African countries because we do not have enough doses, but it's a good step, first step in beginning the process of giving vaccines to the population.
All right, we appreciate your time. Thank you so much, Dr. Moses Masika, a virologist from the University of Nairobi. Thank you for joining us on the program.
Thank you for having me.